Good morning, ma'am. I am Erica Mirufino, your student nurse from Massayan University, Philippines, and I will take care of you from 7 a.m. to 1 p.m. For safety purposes, may I hold your hand as I check your ID band, ma'am? Yes. Okay. I'm here to perform a demonstration of an assessment of your lungs and thorax. And why we do this to ensure that everything is normal. And if there is abnormalities on your thorax and lungs, we're going to look at them, okay? To prevent any further complications. Do you have any question before we proceed to the assessment?
None.
Okay, but if you do have, you can ask me throughout our assessment. Okay? Now, before we do the assessment, we must do the proper hand hygiene. Okay, wait me a second. I'm wearing my gloves. Okay. To prevent the spread of microorganisms, may I ask you if you would prepare an open or closed window?
Closed.
Okay. Closed. So, ma'am, I'm going to touch some parts of your body that we're going to examine. Like as I said earlier, to ensure that everything is normal. Is it okay with you?
Yes.
Okay. Thank you. But rest assured that there is confidentiality between me and the physician that I'm going to refer you, okay? Okay, in order for me to assess those, I need to inspect, palpate, percuss, and auscultate, and listen to your breath sounds, okay? So, ma'am, can you turn around? So, okay. Now, I'm going to ask you some questions. Okay. About your past history. Okay, is there any past history of stroke or heart attack?
None.
Okay. How about your current situation? Do you feel or experience difficulties in breathing?
No.
Okay. Is there any signs or symptoms of lung disease like lung cancer, allergies, tuberculosis?
No.
Okay. How about your lifestyle habit? Do you smoke or vaping?
No.
Okay. Do you experience any swelling, coughs, or wheezing or pain?
No.
Okay, I'm going to take note of that also. So, I'm going to start and perform and assessing the posterior thorax of my patient. Okay? I'm going to open your back, ma'am. And I'm going to do the assessment. Okay. Okay. So as I expect, ma'am, your color is in light brown. There is a presence of hair, and there is no any signs of wounds, skin breakage, and scar. And there is a quite few mole here, over here. And that is normal. Okay? The next thing that we were going to do is the posture and shape of the thorax of my patient. Okay? Ma'am, as I inspect, you have a good posture and your thorax is in a dome shape and symmetric. The ratio of the anterior posterior to the transverse diameter is even and consistent to the color of your face. And as I inspect also, your balance is upright and it is normal. So, ma'am, allow me to palpate your back to see if there is any signs of abnormalities like my area of tenderness or such a personal issue, and tell me if it's hurt as I touch it, okay? Do you feel any pain?
No.
How about here? Do you feel any pain?
No.
How about here? Do you feel any pain?
No.
Here. How about here? Here.
No.
How about here? Okay. As I observe, ma'am, there is no lumps or masses or area of tenderness, and that is normal. Okay. Okay. The next thing that we want going to assess is the scapula. So, as I inspect, the scapula is symmetrical and it is equal to the horizontal position of your posterior back. And there is no any signs of swelling, also an indication of bone dislocation, and the findings are normal. Okay, let's now proceed to the intercostal space, or the space between our ribs. Okay, ma'am, now I'm going to percuss your back. Okay. Okay, as I observed, ma'am, it is symmetrical in movement, and there is no any signs of bulging or retraction, protrusion or displacement, and that is normal also. Okay, we're now moving on to the rib symmetry and the movement. Okay. Okay, as I observed, the anterior posterior of your back, ma'am, the chest is less than the size of the transverse diameter, and there is no any signs of deformities, barrel chest, or even kyphosis or scoliosis, and that is normal. And now I'm going to check the temperature of Miss Mabasa. Okay. And I will be using the dorsal or the back of my hands. Okay. As I checking it, ma'am, it is warm and it's not too hot either cold as I checking it. Okay, the next thing that we gonna assess, which is the skin turgor. Ma'am, can you face me? To do this, ma'am, I'm going to do the pinch test, and is it okay with you if I hold your hand?
Okay.
Okay. About here. Okay, ma'am. As I pinch it, it returns fold to its normal appearance within seconds or less, and the finding is also normal. Okay, ma'am, can you turn around again? Okay, let's now proceed to the spinal alignment. Okay. Okay, your spinal alignment is intact and you are in the right position. There is no signs of misalignment going to the shoulder, and hips are in the same level. And also the anterior posterior diameter and transverse diameter is in ratio of 1 to 2 ratio. The color is even. It is consistent with the color of your face. Okay. Now we're moving on to the next assessment, which is the chest excursion. Ma'am, I'm going to put my hands on your back and I need your cooperation when I said inhale and exhale, okay? Inhale, exhale. Inhale, wait lang po. Inhale, exhale. Okay, another one. Inhale, exhale. Okay. As I inspect, there is a full symmetric chest excursion, and my thumbs are equally separated to 3 to 5 centimeter, and the finding is normal. Okay. The next thing that we want to do is the tactile Framatus. Ma'am, I'm going to palpate your back again, and you will say 99 as I put my hands on your back. Okay. 99,
99,
99,
99,
99,
99,
99,
99,
99.
99.
Okay. Ma'am, as I observe it, your tactile framatus is symmetric and I can feel the vibration when you say 99, and upon observing there is a decrease over heart and breast. Tissue framatus is the most important between the scapulae and decrease as you progress down. Also, framatus provides the information about the density of the lungs through gravitatory sensation. And now we're going to do the vocal framatus. And it will be done using my stethoscope. Can you say E 3 times, ma'am?
E, E, E. 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 E, E, E.
Okay, ma'am, upon assessing, while you are talking the sounds of E 3 times, the sounds muffled or indistinguishable. Okay? Now we're going to assess the breath sound. And I'm going to ask you again to inhale and exhale, okay? Inhale. Exhale. Okay. Inhale. Exhale. 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 Okay, ma'am. Upon checking it and auscultating in some area of your trachea, bronchi has a loud and harsh. Unlike the alveoli, the sounds are smooth and there are no signs of adventitious sounds like crackles, wheezing, bronchi, stir, and friction rub, and the findings are normal. And now we're moving on to the anterior thorax of my patient. So ma'am, I'm going to assess your anterior part. Okay, can you face me? Can you turn around right here? Okay. As I expect, again, your color is in light brown and there is also presence of hair. There is no any signs of wounds, skin breakage, and scars. And also there is a quite few mole here. Here also, at your neck. So, the finding is normal. So I'm going to check the posture and shape of your thorax, ma'am. Okay. Okay, as I inspect, the skin color varies from light brown and it is uniform. It is generally uniform. It is also there is no any signs of wounds and skin breakage. Now we're moving on to the scapula, ma'am. As I inspect, okay. As I inspect, your scapula is symmetrical and is equally horizontal position. There is no any signs of swelling, indication of bone dislocation, and the finding is normal. Okay. The next thing that we will do is the rib symmetric and movement. Okay. Okay? As I observe, your ribs is symmetrical and it is sloping downwards. The anterior posterior diameter of your chest is less than the size of transverse diameter, and for the temperature, again, as I inspect earlier, it is warm and it is not too hot as I touched it, and or either cold, okay? Also your skin, as I pinch it, it returns full to the normal appearance within seconds or less, and the finding is normal. Okay, the next assessment that we will do is the chest excursion. I'm gonna put my hand on your here. Is it okay with you?
Yes.
Okay. And can you turn around slightly here to your left? Okay. Inhale. Exhale. Inhale. Exhale. Again, inhale. Exhale. Okay. Okay, as I inspect, there is a full symmetric chest excursion, and my thumbs are also separated in 3 to 5 centimeter, and that is normal, okay? Again, we will do the tactile Framatus, and will be done by palpation. Okay, can you say, ma'am? $99,
$99,
$99,
$99,
$99,
$99,
$99,
$99,
$99. Okay, ma'am, as I observe, your tactile Framatus is symmetric, and I can feel the vibration when you say 99. And upon observing, there is a decrease over heart and breast tissue. Framatus is the most important between the scapulae and decrease as you progress down. And also, Framatus provides the information and density of the lungs through the vibratory sensation. Okay? Now we're done doing the tactile Framatus, and we're moving on to the vocal Framatus. Okay? And it will be done using my stethoscope. Can you say E, ma'am, again?
E, E, E. 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 E, E, E.
Okay? Ma'am, upon assessing, ma'am, while you are talking again the word E, it sounds muffled and or indistinguishable, okay? Now we're moving on to the breath sounds. Okay, I'm going to do it using my stethoscope, and I'll ask you to inhale, exhale again. Inhale, exhale. 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 Okay? Ma'am, upon checking and auscultating the some areas of your trachea, bronchi has loud and harsh. Unlike the alveoli, the sounds are smooth, and there are no signs of adventitious sounds like crackles, wheezing, bronchi, stirrer, and friction rub, and the finding is normal. Okay? Now we're moving on to the chest wall percussion notes. Now I'm gonna put my hands again. Is it okay with you? Okay. We're doing this because to determine whether the lung tissue is filled with air and it is solid. Okay, as I percuss, it resonates except over the scapula. The flat over scapula and rib is normal. The dull over liver is also normal. Okay? Thank you for your time and cooperation. I will refer your case to assigned staff nurse and physician and will address your concern as soon as possible. Okay, thank you.
Thank you.
And now we're done assessing our patient posterior and anterior thorax. And now we're gonna remove our gloves and PPE. And throw it away because it may spread some microorganism if we expose it after we use. Thank you and God bless. Stay safe everyone.